well. And if you have pregnancy questions, ask them in the comments. Yesterday, I asked you guys like your top 5. You could only buy 5 things for your baby. What would they be? And I got some really good answers. So I would love to know your answers in the comments. I have a post over on Pulling Curls that's about, I narrowed it down to 16 things, I think. So just trying to like no frills it out. I don't know. Are you guys interested in a no frills baby list, or do you want all the frills? I guess is the question. Does anybody have any fun weekend plans? Ask me your pregnancy questions. I would love to answer them. Oh, have you guys also heard of Postpartum Support International? I was just at a conference last week and learned a little bit more about them. Oh, it is the right way, at least on Facebook. TikTok, you're the wrong way. 1833 TLC Mama to talk about mental health. So that's kind of helpful. If you guys tell us me in the comments if you've heard about it. Hello, Facebook, Instagram. Looks like most people are from Instagram. Hello, Instagram. When can you feel or see the strong kicks? Guys, ask me comments, questions. I'm happy to answer them. When can you see the strong kicks? So you obviously will see them. Usually I would say people aren't seeing them until almost to their 3rd trimester, which starts about 28 weeks. Usually people start to be able to feel them 18 to 20 weeks, probably earlier if it's not your first baby. So that's usually when people feel them. Hi, Amber. Good morning. Third pregnancy within 3-year span. Is it normal to have upper abdominal pain? I mean, I don't think that it should matter that you have had 3 pregnancies in 3 years for that abdominal pain. So I don't know what to tell you on that one. Sorry about that. Any more pregnancy questions? In case we haven't met, hi, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. And I am also the creator of the online prenatal class for couples, which is the easy way to get prepared for birth. I would love to see you guys in there. Today only you can use coupon code Father's Day to get 24% off because it's Father's Day 2024. Abby, I suffered an AFE on November 21. I wish there was a class on warning signs and symptoms of problems. So the hard thing with that one is there really aren't, no one wishes that more than labor and delivery nurses, but there really aren't any warning signs other than you immediately feeling impending doom and then not doing so well. So, yeah. Do you follow the Birth Trauma Mama? I think her name is. I just met her at my conference, so that might be somebody to follow. Elizabeth, is drinking castor oil while pregnant safe? Most people don't think so, Elizabeth, because it can cause gastrointestinal symptoms and can cause a baby to also poop in the womb, which is problematic when they inhale it, as I'm sure you can imagine. So I don't recommend castor oil. Also, you just like poop and poop and poop and poop forever, and you're miserable, and then you have contractions plus your stomach cramps. That to say, I think the only thing in studies that I have seen is the midwife's brew could possibly put you into labor. But again, is it safe? That's the question. Studies point to the fact that it is much safer to have a medical induction in the hospital with Cytotec or Cervidil or Pitocin. So, yeah. Ashley said, is it normal? Facebook, Instagram, YouTube, feel free to ask your question in the comments. I'd love to answer. Is it normal for my midwife to want to induce me on week 39 with an IBS pregnancy AMA? I believe it is customary to offer an induction at 39 weeks of pregnancy. I was just talking to a friend about this, but you don't have to do it. I would probably get an NST. You're probably getting those anyway, and then maybe a BPP. If you guys have questions about that, I talk about all 3rd trimester testing in my prenatal class. But I think you would want to do those. You're going to want to make sure that you're doing your kick counts. The older you are, the more likely your placenta is going to poop out early, is the big thing. So you want to make sure baby's moving. That's your best indicator of fetal well-being. If you guys have questions about how to do kick counts, because my gosh, I hear a lot of people telling people to do them wrong. You can find a cheat sheet under resources on my site. It's free. So good morning, everybody. All the questions. Let's see. Okay, so she knows the birth trauma mama. I wouldn't recommend other people follow her, but it's fascinating. And I talked with her a little bit while I was at the A1 conference. I think she would be really helpful. I'm 29 weeks with my first. I feel baby move, but I don't see them yet. Yeah, it really depends on where baby's positioned, how strong their kicks are, the layers of fat, things like that. It will come, though. I feel like around 30 weeks is when I could start to see it more. And then it turned into like War of the Worlds sometimes, especially when I was at church. I felt like the baby was just like dancing around at church. I was 18. My baby ripped the placenta in half, so she was drowning in the blood. Oh my goodness, Abby, I'm so sorry. How do I feel about period apps? I mean, I track my period on a period app, so I don't know. I'm not looking to get pregnant, though. On Facebook, Rian said, I'm 36 weeks pregnant while baby is measuring 38 weeks. Do you think I'll make it to 40 weeks and him 32 weeks, 42 weeks, or do you think it'll induce me way sooner? Rian, I think it would. The big question is, and I'll put a post in the comment, is baby continuing to grow like that? Is it just the measuring on the measuring tape, or is it an ultrasound measurement? A lot of times people on the measuring tape, when they measure your fundus from your suprapubic bone to the top of your uterus, you'll measure large. And if they're concerned about that, then the next step should be an ultrasound, because some of that is just like water weight, kind of how they measure, different things like that. So the big question is, are they measuring big on the ultrasound? And I have a post that, because you're on Facebook, I can just pop in the comments over here. So it doesn't always mean that you'll go early. They could recommend inducing you early. That is a reason to induce a baby early. So yeah. How do you do kick count? So let me boil it down, but I would get the cheat sheet under resources. It's a freebie. So you'll go to resources, you'll click on free resources, and then you'll see the kick count tracker. You can sign up to get it in your inbox. But you're just looking to see how long it takes baby to move 10 times. So for everybody, that's going to be different. And so often I just had somebody the other day say 5 movements in 1 hour. I'm like, I don't even know where they got that. Some doctors will say 10 movements in 2 hours. That's probably where they got it. For some people, if your baby only moved 5 times in 1 hour, that would not be a good sign and could show that baby is ill, right? Not doing well. For some people, that is way more than baby moves, especially if they have an anterior placenta. So it's really important to track how long it's taking baby to get those 10 movements, right? So after you've done it for a week, it takes baby 15 to 20 minutes to give me 10 movements, right? Then after that week, you notice you're at an hour and you're only at 8 movements, then you're going to be concerned. And when you go into the hospital, you're going to be able to say, I do fetal kick count movements every day. And today I noticed that baby, only moved 8 times in the hour. Baby's movements have decreased, and make sure you've been fed and like all the other things. That's why I like to do it the same time every day. For me, I like to do it after dinner because baby moved a lot and I also didn't have to clean up dinner. So that's what kick counts. Super passionate about them. Grab that kick count tracker. There's kick count posts on all of my websites. There's podcasts about it. My podcast is called the Pulling Curls Podcast. If you want to look that up, it could be really helpful as well. Let's see. On Facebook, we have what to take for constipation. You got to talk with your provider. Sorry, I can't tell you about taking anything, but you can always increase your fiber. Hello, beans. Fruits, strawberries, raspberries. Berries are a great way to increase fiber too. Bethany said, I'm 34 weeks and baby girl's lays transverse on my pelvis. Any tips to get her to flip head down? Bethany, I have a post that I'll put, but it's on the Pregnancy Nurse if anybody wants to look it up. It's 3 ways to get baby to flip head down. But the short of it is, let's see, the spinning babies. So you can just Google that, spinning babies. Chiropractor. I've had lots of people have good luck with a chiropractor. You want to go earlier rather than later, and versions with your provider. But I got to say, some providers are not great at versions. So, yeah. My baby has his moments. Some days they kick more than others. The other thing I didn't mention is that you only start kick counts in your third trimester. So you're not like, as soon as you feel baby movements, that would not be a time that you have a real pattern of fetal movement. So once you hit about 28 weeks, then you can have that pattern. Sorry guys, we have a comment that's it's just not helping out. Yeah. GD diagnosis if my glucose level is 191. Was that after the glucose test? I think that might be one that they just like say, yeah, hello, unicorn princess. I don't know exactly if they'll just, I don't have those numbers memorized. So talk with your provider. It depends on if that was after the 3 hour or just after the 1 hour test. I believe that's high enough that they would just say GDM, but I'm not 100% sure. So good luck. Hello, everybody. If you guys have pregnancy questions, feel free to ask them in the comments. Bethany said, thank you. You're so welcome. So in case anybody's new here, hi, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. And I'm also the creator of the online prenatal class for couples. It is the easy way to get prepared for birth. It's available 24/7. It covers the rest of your pregnancy, including third trimester testing, which we've talked a little bit about in here. Labor, like what to do in early labor at home, because I think that's misunderstood and a lot of people end up going to the hospital early. We talk about birth. A lot of people are really caught off guard about what happens in those moments after birth and how to manage it. I've seen a lot of people say this wasn't what I expected right as baby came out. We're actually going to we talk a lot about that in my class. And then postpartum, which people just are not prepared for. So they love my very realistic look at postpartum. It also can include baby sleep, baby care, nutrition, doctor communication. So there's kind of 2 levels. If you're a second-time mom, I usually recommend the top level. And if it's your first, then I usually recommend the higher level if that's something you can afford. But the main level will get you prepared for birth and postpartum. So yeah. I would love to see you guys in there. If you have any questions about my class, please ask them in the comments. How long does one generally stay in the hospital after a C-section? Usually it's 2 to 4 days. Kind of depends on when your section was. Because, yeah, I mean, if that makes sense, because if it was like late at night, then usually, you don't stay till, anyway, 2 to 4 days, depending on how you're feeling and all those things. But I think insurances will only pay for 4 days. Most people, I think, stay 3 nights and then they go home. They're ready to go home at that point. But if you have complications or any issues with the wounds or stuff like that, yeah. What to do when you're 25 weeks single and have no help with baby items. I would encourage you to just look out in your area. A lot of times OBs will have a social worker that works with them, or they can get you in touch with a social worker at the hospital. There are a lot of places where people can get help for the things that they need for baby. And especially because you're only 25 weeks, I would 100% recommend getting in touch with them, because the earlier you are, they're just excited to see that you're planning. If your provider doesn't have anything, you could reach out to Planned Parenthood and see if they have any resources that you could contact. There are lots of places that can help new moms. We just got to get you connected with them. Yeah. PCO, do they calculate your due date differently because of PCOS? No, initially it is always based off your last menstrual period. And then usually they like to get you in for an early ultrasound, usually before like 15 weeks, to see how baby is growing, and then they can date baby on that ultrasound. So those are the 2 things that they usually use. What happens if the cord is not attached to the placenta correctly? There are like a marginal cord insertion, a velamentous cord insertion. They just watch the baby more closely. We don't actually always see those on ultrasound, so they can be a problem for other people, but I've seen lots of babies born with weird cord insertions. So you want to make sure that you're doing the kick counts. A lot of times they'll start you doing NSTs and BPPs. They might do Doppler flows of the baby to make sure that the blood flow is going through the umbilicals to the baby. So Gina said you're going in on Monday to have your baby. Exciting. Still time to get a prenatal class. Unicorn Princess said, do I have to have a pelvic exam my first prenatal visit? Often at that first one, they want to do a cervical, like a pap smear. They want to do STI testing. Super, super important. We do not want baby growing if you have any STIs. So those are the things. It's different than a pelvic. And if those are the things they want, you could say no to the pap smear if you want, and you could probably do the other ones on your own if you really wanted to. Although I would rather have them do it. But you need to make sure that you're getting the STI done. STI testing. Some people just do them on urine too. So. Why? Let's see. We have one from Facebook. Do you recommend starting pump around 37 weeks to encourage your milk to come in? No, I don't. You definitely wouldn't want to pump before then because you could start preterm labor. And I just think there's nothing you're going to do that's toughening up your nipples, and your body is not prepared to make milk. But I always recommend following the Breastfeeding Mama. She's on Facebook, Instagram, TikTok, just like me. She is my breastfeeding guru. She's the one that teaches the breastfeeding class and the online prenatal class for couples, which is just a real simple class that explains breastfeeding, and that, it's made my class like a one-stop shop for everything you need before birth. So come join me in there. Is frank breakage a concern at 33 weeks? I've been trying all the tricks, but I can't get them to flip. They may stay that way. Keep trying the tricks. I would recommend going to see a chiropractor. I think it could make you feel a whole lot better with the things that I see them do on people's pelvis. It just looks magical. And possibly consider aversion. You're still a little bit early for that, but I think seeing a chiropractor could be really helpful. You want to make sure that you find one who's trained in the Webster method. That's what it is. Unicorn Princess said she's worried about miscarriage if they do. Have that discussion with your provider and then see what's best for you. Chelsea said she breastfed 30 years. That's awesome. Any other questions? I know that pumping for colostrum is like all the rage lately. I'm hearing nurses who say people are just bringing in like bags and bags of syringes with you into the hospital. And I think it can be, ask your question again. I'm not scrolling back up because it's moving so fast today. Sorry. But I don't think that's going to be super helpful. I think there's better ways to use your time. And if anything, you definitely don't want to stress out over pumping before baby's born. Yeah. How long is mild cramping normal? If it's something new, it's a new symptom, I would call your provider. I don't know how far along you are. Sometimes mild cramping can happen a lot in the last few weeks of pregnancy. I don't know that much about DPO levels or blood levels at early pregnancy. Sorry, I don't answer questions like that, but I wish you guys the very best for sure. Let's see if I can scroll up at all. She said, why do we only do 10-week ultrasounds? Any tips if I'm carrying twins, high risk? They don't just do a 10-week ultrasound. So routinely they recommend an early ultrasound, just kind of whenever you can get it early on, and then a 20-week ultrasound where they'll check anatomy and stuff. But at a 10-week ultrasound, they should be able to tell if you're carrying twins. So I don't know if you want an ultrasound earlier than 10 weeks. You can always ask, but you will get one at 20 weeks as well. But they would know if you were having twins at the 10-week one. They would see 2 heartbeats. Any more questions, guys? Looks like people are kind of dropping off. Just a reminder, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am the creator of the online prenatal class for couples. And I would love to see you guys in there. If you have any questions about my birth class, I would love to answer them below. Weekends are a great time to get started in there. I know I always have tons of people in the class getting going on the weekends. Is it okay if your baby is measuring a week bigger? Not unusual at all. You got to think After about your first trimester, babies grow at their own rate. So if you look at a preschool classroom of kids who are all 3, you're going to have lots of different heights, and that's the same for babies. Babies vary in height and weight. So no reason to be concerned if baby's measuring a little bit of big or small. Just think of it as just how kids are. Would you go in earlier? Would it be worth it? I don't know if you can. I've heard people having a hard time getting them scheduled. So if you want to be seen earlier, call your provider and see if they can do it earlier. If not, then just go in at 10 weeks. Is brown discharge when wiping normal almost 6 weeks pregnant? It can be just something to keep an eye on. Any cramping, usually it's brown discharge is usually old blood. So you're more concerned about like new fresh blood. So yeah, thank you. You're welcome, Kristen. All right. Thank you guys for joining. Remember, you can use coupon code Father's Day to save 24% on the online prenatal class for couples. I'm not going to be running sales much after Father's Day weekend because it's going to be summer and we're going to be with the family. So if you're interested in getting the prenatal class, now's the time to do it. It does come with a money back guarantee. If you get in there and it's just not what you're looking for, you can email me and we will refund your money. It also has a best price guarantee. I think it is the best priced birth class online. Everybody else charges like $400 to $600, and I just think that's insane. So it starts at $89 minus the coupon, which will make it a great deal. And then the second tier that includes baby sleep, breastfeeding, doctor communication, inductions, baby care, some other stuff I'm forgetting, that starts at $197 minus the 24% off coupon. That's almost a $50 savings on that one. That's a good deal. Do I smoke cigarettes? No. And I don't recommend anyone else who's pregnant smoke. Okay, thanks so much for joining today, guys. Thanks for all the likes. That was awesome. I hope everybody has a good weekend. And if you have fathers in your life that you help, I need to call mine. That just reminded me. So thanks for being around, and we will talk to you guys later. Bye.